February is American Heart Month, a good time to take pause and focus on our cardiovascular health. While we often talk about common warning signs like shortness of breath, our skin can be telling us something is wrong. Joining us now to explain is Dr. Glynis Avalon with the Avalon Skin Institute and Research Center. Thank you for waking up with us today.
Of course, happy to be here.
You know, heart disease is the biggest killer for men and women, and our biggest organ, our skin, can really tell us a lot when something's off. Tell us about some of the warning signs that we should not ignore, especially if we're swelling. Sometimes we think, oh, I ate too much salt or something like that.
Yeah, many diseases of the heart can actually cause fluid to build up in your feet and legs. It's known as edema, and when this fluid builds up, you can see swelling, which can actually extend all the way up to your legs, all the way up the legs and into the groin, and it can suggest basically that your heart isn't working properly. So if you actually notice any swelling that's bilateral on both sides, don't, if it doesn't resolve within the first few weeks to a month, or if there's any pain associated with it, you need to follow up with your physician.
Also, we should be paying very close attention to our skin, right? Changes in our skin, whether it's a different color or new kind of pattern or even a growth, that could really indicate something's going on with our heart, especially growth right around the eyes.
Yeah, so there's a couple different things going on. Number one, be aware. Know your body, know what normal feels like and what abnormal feels like, and then you can get different kinds of growths. Of course, there are yellow-orange growths that actually can appear around usually the eyelids, but they're known as the xanthelasma, and they are deposits of cholesterol under your skin, and they're painless, but they can show up in your eyes, your palms, the back of your lower legs. If you notice these, then you want to see your doctor and point them out. You may need cholesterol testing or other medical tests.
So good to know. You know, another lesser known symptom that we know about of heart trouble has to do with our nails. Doctor, talk to us about the changes we should be looking out for and why these really shouldn't be ignored.
Nail changes are very interesting. The idea, again, is to know what your nails are like throughout your life. If they are always looking curved with a little swelling on the tips, that can be a sign of normal. However, if it develops later in life, it actually can be a sign of heart infection, heart disease, or even lung problems. And so the idea is that if these changes occur, you want to point these out to your doctor.
This is so great to see these visuals. Bottom line, if something's not right, get it checked out. Dr. Avalon with the Avalon Skin Institute and Research Center, thanks again for joining us. You can get more information by visiting AvalonInstitute.com. Great tips there.